You're listening to the Turn Autism Around podcast, episode number 171. Today, we are trying something a little different. I have our community manager, Kelsey General on. Kelsey has been on two other podcasts. She was on at the very beginning for my first interview, podcast number 3. And we're going to have her come on a regular basis, maybe once a month or once every 2 months. And we're going to cover the top 5 questions in an area. So we are starting today with this episode talking about the 5 top questions we get from our members about problem behavior. And I know we just did a problem behavior podcast just a few weeks ago, episode number 169, when I talked about the No More Timeout course, but we get a ton of questions about problem behavior, and we're going to look at it from a different lens. And Kelsey's going to weigh in with her information as well, and her viewing the different ways that she's a single mom of 2 young boys, both diagnosed on the spectrum. And so she offers great insights, and she's also a professional in the field. So let's get to this really fun interview with Kelsey and me having a discussion about the top 5 questions we get on problem behavior. Okay, so welcome back to another episode of Turn Autism Around. And we, as I said in the intro, we're going to do something a little bit different today. We have Kelsey General, who is our community manager. She is on podcast number 3 for her first podcast episode. She also did another podcast episode with a professional about a year ago or so. And now we're going to try this. We're going to talk today all about problem behaviors and the top 5 questions we get about problem behaviors within our courses and membership program. I started thinking about this, one of which, because problem behaviors is such an important topic. It's one of our most downloaded podcast episodes, is podcast number 6, all about problem behaviors. We also did several other podcast episodes, blogs, which we're going to mention those while we do the show today and while we answer the questions. It's going to be more of a discussion, I think, between Kelsey and I. But I just did a podcast pretty similar a couple weeks ago to announce our mini course, our very first mini course called No More Timeout. And that is podcast number 169. So we're going to try not to be too repetitive, but, since the mini course is brand new as of a couple of weeks ago, I wanted to also talk about that and how for a very low price, you can start really coming into our community to learn more. You're obviously listening to this podcast, which is free, which is great. But we have found over the years that there's so much content out there, both from me and from others, that if you can join us to learn more, that would be awesome. So Kelsey and Rachel from my team started to do an getting unstuck call with our members. And I actually don't attend the call, and I have been watching the last few, and Kelsey's just really doing an amazing job with answering the questions, both within our Facebook, closed Facebook community for paid members, as well as on these unstuck calls. And so I thought maybe once a month, once every 2 months, we'd have Kelsey on and we can talk about the 5 top questions we get, and we can discuss them, discuss our answers, both my answers as well as Kelsey's answers. And just a disclaimer, nothing in this podcast, in my books, in my online courses, are medical behavioral advice. All of my information is for informational purposes only. And so even if you did buy the course, the full course, if you buy the mini course, anything you learn there, you really have to apply it with eyes wide open. If you're a professional, if you're working with professionals, you need their judgment, because we don't know your child, and you could, problem behaviors is one of those things that can definitely get worse. If you're doing the wrong thing, if you're doing the wrong thing sometimes and the right thing sometimes. And so you have to really be careful, because obviously kids can have extreme problem behaviors, which we never want. Okay, so let's get to the 5 questions. Let's just bang them out, Kelsey, and see what kind of discussion we can have about it.
See where we go. Yeah. So a lot of the questions we get in our Facebook groups are relating to, I have this problem. How do I stop it? But, before I tell you the question, Mary, as you've said in our top podcast, number 6, and even in the No More Timeout podcast, we want to really be preventing problem behavior. So that's probably what you'll hear me and Mary focus on mostly as we go through these questions, because I know it's easier to ask, how can I stop this? But honestly, we want to just prevent it.
Right.
So one of the first questions we get a ton of is, my child bites me or chews on non-food items throughout the day. How can I stop this? So you can start.
And actually, biting and chewing are really different in a lot of ways. But biting, let's tackle that first, because as I said in podcast 169, I mean, biting is one of the most severe problem behaviors, especially if you're biting other people. It can get you thrown out of some of the best places like schools and daycares. And because as a registered nurse, I mean, I know this for decades, right? You can transmit disease via bites. It's one of the few ways where you can actually give someone, transmit hepatitis B or AIDS, even HIV. Like it is serious. And the other thing I didn't know actually decades ago, which I've learned as a behavior analyst, that human bites are actually more dangerous than animal bites, which I had no idea about. So biting is something that you really, really want to prevent. And I talk a lot in podcast 169. I talk a lot in the No More Timeout course about how we have to prevent biting. I also did a podcast interview with Dr. Timothy Bulmer, who is one of the leading international experts on problem behavior. And we can link that in the show notes. But he and I talked about how in all animal species, birds, animals, dogs, those sorts of things, that if they're stressed or startled, they might have in pain, they might bite as a reaction. And if you think about like humans before anesthesia, like old cowboy movies or women in labor before anesthesia, people would tell them to bite on a towel, like to take the pain away from, the amputation of the leg or something like that. So that's kind of extreme. But if we have kids that are biting others or themselves, in my case with Lucas, I mean, one of his problem behaviors that's still not completely gone is self-injurious biting of his hand or his knuckles. So it's gone way, way down, and we have it almost at 0, and that's where we need it to be. But if he does bite himself, it is almost always pain related. And he has enough language to tell us about that pain a little bit, but it's often accompanied by screaming and biting himself. Unfortunately, his aggression is completely gone, and we don't have any biting towards others. But in the past, that has been an issue as well. So I did do a video blog as well on biting. I can link that in the show notes. So this is going to be podcast 171. So if I say show notes and you're out driving or running or whatever you're doing, You can always type in, Mary and Kelsey top, 5 questions about problem behavior, and you will find us. Or if you can remember 171, it's marybarbera.com/171, and you'll get all these show notes. But for biting, it's really important. Just say they are biting others. What body part are they biting? I remember a teacher once saying, he bit my ankle. And while we were in the playground, he bit my ankle. I'm like, what was your ankle doing near his mouth? It was kind of my question. But I mean, it's not funny, obviously. But, if kids are biting you, I remember it was, I think, the same teacher, she got bit on her chest by another student. It's like, we need to be on the defensive, right? And keep our body parts away from kids if they are agitated and might bite. We need to protect ourselves. And we need to, as Kelsey said, do a lot of prevention. I tell the story in recent work that I've done of a young 2-year-old biting his dad. Okay, what body part is he biting? Oh, on the shoulder. That's a big old clue that the dad is carrying him somewhere. Maybe he's carrying him when he's upset. It turned out he was carrying him up the steps to take a nap and go to bed. And the kid wasn't even upset. It's just, it became part of the routine. Dad didn't know what to do when he actually did bite. Why was he carrying a 2.5-year-old up the steps? So there was another discussion. So these all are clues, and we have to prevent. Yeah. Before we move into chewing, Kelsey, anything to add there with biting?
Not much. I mean, Brentley has only ever bit. So Brentley's my oldest son, who's now almost 8. He's only bit one time, and it was to a staff member at daycare, and it was not good. And he had an increase in other problem behaviors leading to that. But that day he bit, I was like, something's wrong. I took him to the doctor, and he had double ear infection. And that was he's never bitten since. And so that was a clue. So that would be the first thing. And then another thing to prevent biting that I like to say is, like any problem behavior, like you said, Mary, when they were carrying him, he bit. But like also, if a child is likely to bite another child when a toy gets taken because they're upset, they have no language. We don't want to put a child who's prone to that with 10 other kids and 3 toys. We want to know to be beside the child when something gets taken, to immediately keep everyone safe. So just like positioning yourself, like Mary said, in ways, and other kids in ways, and just being proactive. Oh, when I tell him no, I know he might be ready to bite.
Yeah.
And so as we build skills, we're still protecting to just prevent that. So those would be my main.
Yeah. Yeah. Excellent points. And I do just want to add that Lucas bit a few times when he was 2. And then when he bit again, it was like age 6. And he ended up with also with ticks at the time. And I've done some work on PANS and Pandas. Let me link the blog and the podcast on that, because again, that was a medical issue. We took him, we were treated, and then, it was years later before there was another bite. And biting himself, kind of started kind of late too. But again, it was allergies, it's headaches, the Inderol, which is a cardiac med, really, really improved the situation. And we talk all about that with Dr. Murray in a podcast episode. The other point you made, Kelsey, about toys and kids and 10 kids and a biter in the crowd. Sometimes, kids do get kicked out of preschool and daycare, and sometimes they need to not go there. And the times that they do go there, they need a whole lot more support than they're getting. So I did do a blog on getting kicked out of daycare and preschool, but if your child is biting, they have no business being in a classroom with 10 kids without one-to-one support. And even with one-to-one support, sometimes you have to pull them. It's just not appropriate at that time.
Yeah.
Doesn't mean they're a failure, you're a failure. This is going to be a lifelong thing. It's just they need more support and more teaching right now.
Yeah.
Okay. Just want to move on to chewing briefly. Mouthing and chewing is another problem that Lucas had a lot of. And I have clients, previous clients, we have online participants where kids are chewing on shirts, on sleeves, on toys, mouthing, pica. We've done a couple video blogs on mouthing and chewing and pica, which is a whole another issue. And the let's just use a pacifier to plug them up for biting or plug them up to chew on is not the answer either. But chewing, I have found that it could be a nutritional deficiency, and even pica can too. Either, could be lead toxicity, it could be zinc and magnesium too low. And I'm just throwing out some ideas. I mean, it could be anything, or it could be a medical issue. So we want to look at what they are eating. It could be, I talked to Dr. Keith Williams about scurvy and all these weird things that he's seeing in kids that are just really have feeding issues and nutritional deficits. So again, if you have chewing and mouthing problems, I would take a look at those specific video blogs, but I do think that they are different than biting.
Yeah, chewing, in my experience, like it could be different. For a young child who's chewing and mouthing, they might developmentally, when you look at their assessment, be 6 or 9 months old. And so in that case, we want to look at medical, but we also just want to get going with building skills, as your book discusses, at getting them to the table and just building other skills, because often it can be like a stim, like there's not much else to do. So here's this toy. It feels kind of good when I chew. The other thing is to really look at, especially when you're looking at chewing, and a lot of people will want to replace it with a chewy, and you did a video blog on that and why chew toys might not be appropriate. But I was thinking about this client I had, and at the time, I think he was in kindergarten. He might've been in grade 1. He was chewing his shirts to the point, mom was just getting dollar shirts from from the thrift store, because it was just every day a new shirt was needed. And it was interesting. One day I was with him in music class, and he had chewed through this shirt, and there was like a strip of shirt. And so I took the strip of shirt and made it kind of into a chewy, because I'm like, well, this is what he was chewing on. And so instead of taking a shirt, I would give him this replacement for his shirt. It's the same fabric, right? You would think that he was not interested in that. He wanted to just chew. And what we found in that moment was it was purely attention. People were always like, put your shirt down, put your shirt down. Oh, let's go change your shirt. There was all this attention around this chewing of the shirt, that once it was like, okay, your shirt's destroyed, let's take. And once no one said anything about it for a while, and just when his shirt was destroyed, we would just put a new one, no, whatever. He stopped, totally stopped doing it. So it's always important to look at, if you are going to try a chewy, or if you are going to try some things, to look at what's really happening and if it's actually replacing anything. Yeah.
And when the child chews, in what setting, what happens right after the chewing. Even silly things like if the child's chewing continuously on their sleeve, wear short sleeve shirts. Yeah. If their child is chewing on the necks, I can pull this shirt up right now and I could chew on it. But if I had a tighter shirt on that, came down, I would, so putting, not that we want to put kids in, way too small shirts, but more fitted. It's just not as desirable to really, and keeping them busy. You brought up, Kelsey, skills. You teach a child to talk, to eat real food, to, engage, to imitate, to have fun, to accept reinforcers. And a lot of those problem behaviors can fade out.
Yeah. Yeah. So those are really the top questions we get about biting and chewing. And like we both said, being creative and figuring out when it's happening and how you can prevent it. So yeah, we can move on to question 2.
Okay.
And that one is all about being told no. Like when told no, my child flops to the ground and cries or gets aggressive, like hits me. How can we stop this?
Yeah. So it is tough. And in the beginning, when you're just learning what to do, to be as positive as possible, to be the giver, to be the yes man constantly, and not to say no constantly. You have to consider not only the child's age, but their developmental age, and learning rules and learning when they can have things and when they can't is kind of a tough concept. And so again, we're going to have to look at not just when told no, they drop to the ground, they become aggressive, time of day it happens. First of all, we usually ask if somebody says in our closed Facebook community, somebody says, my child, if I tell them no for candy, they drop to the ground and or lunge out, try to bite me or try to grab the candy or whatever. What should I do? Well, first of all, we need to know age, like chronologic age, but also their ability level. So telling, if this 3-year-old is functioning at a 9-month-old level, language level, they're going to understand less about candy later, or no, you can't have candy because you're allergic, or, so you, even if you have a 15-year-old functioning at a 2-year-old level, they're not going to understand exactly when they could have it or why they can't have it or what the alternatives are. So we usually write back, say, what's the child's age, ability level, and how far into the courses are you? That's always the best thing to do, because these courses are laid out so that we can show you how to assess, how to plan, how to teach, and how to keep easy data so you can evaluate whether your teaching procedures are working. So every question we get can be funneled through the 4-step Turn Autism Around approach: assessment, planning, intervention, and evaluation. So it's not just about accepting no, it's really about how preventative are you? How much table time, if you're not doing any table time and all you're doing is trying to keep the peace, which I know is hard. If you have multiple kids, or if you're a teacher and you've got, 8 kids in your class and they all can't accept no, and nobody, they're all nonverbal and they're not potty trained. But the answer isn't to get them to learn, I said no. The real way we need to tackle this, any situation, whether it's at home or at school or in the community, is we need to teach the kids that we are a source of reinforcement. We are positive. We use 8 positives to every negative. We are the givers. We are not the takers. We are the yes people. We're not the no people. And so the child, when you do have to say no, is going to be more accepting of the situation. And one other thing is, if you do have to say no, that they can't have this, you should have alternatives there. And we talk in my book, Turn Autism Around, I talk about the shush, label, and give procedure. So if the child is screaming for candy and he's allergic to it, you can't have it, you don't have any, whatever the situation, it's another kid's candy from the table, for lunchtime at snack or whatever. You can still use the shush, label, and give, but you can't give the candy, but you can give an option of another thing the child will like, but you have to get quiet. You have to get the child quiet. first before you start negotiating or offering other choices or trying to explain why they can't have it. So I know that's like a lot, and I want Kelsey to chime in here, but I think it's a bigger problem than just running an quote unquote accepting no program, which is not what we do.
Yeah. And I mean, you have a full video blog on this if people want more detailed information. But one thing I did when my kids were young was make my life easier and make their life easier. I mean, if you have knickknacks all around the house, you know, and you're constantly saying, no, 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 don't touch, don't touch, don't touch. Yes, we want to teach a child that. But if you, especially if you have a delayed child who's around 6 to 9 months old developmentally, or, you know, you're working on an uphill battle. And for me, and what I try to tell clients is like, this is their home, this is your home. Let's try and also adjust the environment so you don't always have to say no. So you're not always harping on them. It's more, you know, if you're always saying no to cookies and your cookie jar's on the counter, maybe we put the cookie jar in the cabinet, out of sight, out of mind. You know, if it's always grabbing the remotes, put the remotes up high somewhere instead of on the coffee table, you know, and also catching a child being good. So instead of, no, you can't jump on the couch. No, you can't do this. No, you can't. Okay. Oh, you're playing on the floor. You're jumping on the floor. That's great. Let's jump on the floor together. Let's dance on the floor. Wow. I really love how you're doing this. And praising what we want to see instead of always being like, no, no, no. Because often we get questions like, well, I'm telling my child no, and they're just laughing and continuing to do it too. And that's part of this is like, and then when you do have to say no, offering, like Mary said, choices. And if they do scream and cry, know that that is also typical, whether your child has autism is delayed or not. Kids are going to have tantrums. They're going to be upset sometimes. We can be there for them. That doesn't mean that we necessarily have to give it to them. Sometimes it's just, no, we can't have that. And that stinks. And I'm here for you, but we can't have that right now.
Right. And sometimes if kids really, you know, get aggressive, first they cry.
Yeah.
And if that doesn't work, they'll start aggression or start flopping. Sometimes we have to actually, if you just ignore it, it's going to escalate to aggression or flopping or more dangerous situations. You might really want to intervene at crying and just, like Kelsey's saying, like, be there for them, tell them, shh, come on, we'll give you some other options, but you got to calm down. Like, come on, this is not the end of the world. Let's calm down. And I know maybe behavior analysts are listening thinking, oh, I learned, keep the demand on, ignore, like we are intervening at a less intense behavior to try to cut it off and turn it around so that we can go back to being positive. And I like what you said about knickknacks. I remember I was on the phone one time with, a mom of typically developing kids, and she's yelling at them, screaming at them, I think threatening timeout because they ran up her white carpet with muddy shoes. I'm like, oh my God, as Lucas is literally taking a can of soda and dumping it on my family room carpet. It's like, if you've got knickknacks, you've got white carpet, use gates, get a fence, don't have white carpet, outlet covers. I have a video somewhere in my course where a kid was kind of at outlet near the table, move the table away from the outlet, get outlet covers, make your life a little easier. And then also remember that kids, especially if they're developmentally under the age of 5, which is really our focus here, right?
Yeah.
And if they're chronologically older, I mean, my son is 25 years old and he's still functioning below an age 5 level of cognitive and language ability. If they're that, they're going to need a ton of attention and a ton of engagement and a ton of support. And so if, they can't be, on iPads for hours a day. They can't be, left alone, because then you're going to have to put out a lot of fires. And I know that it's hard, but it's just the reality.
Yeah. So that's really about that prevention. The next question we can get into is, my child will not stay with me when outside or in the community stores, they run away. What can I do so that they stay with me?
Yeah, well, Kelsey was Kelsey is actually one of our all-time best success stories. And she works for me now. She has worked for me for a few years, actually.
Yeah.
But one of her big problem behaviors with Brentley when she first joined my online course, which before I, knew her, interacted with her, was he was under responsive in a lot of ways, but then out in the community, he would dart in streets, run in the middle of streets. He's only 2.5 and go into water. And she also had Lincoln, and she's a single mom. So before Kelsey even found my course, she was dealing with extreme safety issues with wouldn't stay with her. So I have done a safety bonus video. I have done safety podcasts, and so we can link that in the show notes. But first and foremost, we got to keep kids safe when they're out. If it takes 2-to-1 support to keep a kid safe, if it takes only going to playgrounds with fences, if it takes not going to playgrounds at all, not going to stores with your child at the moment, or this week or this month, or until you can get, one of the keys for Kelsey, and I think we're going to do a top 5 questions about table time, but part of my Turn Autism Around approach is a heavy focus on establishing table time, even for very young children. But once Kelsey started table time and really started the early learner materials like the shoebox and potato head, and Brentley learned that coming towards Kelsey for reinforcement, not running away, was really beneficial to him. She was able to really pretty quickly, she would show videos of Brentley outside with potato head and getting close to water. And now he's like a pro with every, dangerous situation. So I'm sure you have a ton more, Kelsey, but there was a point when early on, and she describes this in podcast 3, where, before she even took my course, she had to use a leash and a harness to keep them safe. You might have to strap kids into strollers, and there might be people here like, oh my God, don't say that. That's horrible well, it's also horrible to have, like, one of my former clients drowned. I know of a child with autism who got hit by a truck and killed. We have to keep our kids and our clients safe. So what do you have to add?
So like you said, Mary, when I think about a question like this, it's less about how can I stop it in the moment and more what skills are missing, how can I help? And like you said, the first step for me, if your child's not listening to you at home, they're not going to listen to you in the greater world where there's all kinds of fun things to get into. Like, I can jump in a whole lake of water. There's a lot of reinforcement going on that you're competing with. And if you don't even have any, like, Brentley wouldn't listen to, like, give ball when he was holding a ball with a hand gesture. Like, he's not going to listen to stop, don't go to the water, come back. He's not going to listen to those things. He's not going to understand them at that time. So in those situations, you need to do what Mary said. You need to keep them safe, whether it's with a harness, whether it's with a stroller, whether it's with, I wore Brentley on my back until he was over 60 pounds. There's preschooler carriers that you can get to put them, in safe places. If they're older, you might be able to get a special needs stroller approved, or a wagon that has a belt. Obviously, as they get bigger and stronger, it's harder. But that's the first step, is to stop letting the running happen, to stop letting these problems go places where you can be more successful. I know Target has, like, the Caroline's cart where they can sit safely in the cart if you need to go shopping, things like that. But then think about building your table time, teaching skills. Once we started at home, it was just like we would teach any skill. I taught Brentley what stop meant. It means you stop your body. I taught Brentley what come here means, and then we eventually taught we're staying on the slide. And then he'd get reinforcement for staying at the slide. And he'd get reinforcement for staying on the climbing. And that's how we built. And I stopped yelling. Brentley's always had poor name response, like a lot of children with autism do. I stopped in the community. Even still, I don't yell Brentley at him. I yell what I need him to do, because I don't need him to respond to his name. I need him to stop so he doesn't run off a cliff or something. So those are all things. And I think if you take it as this is just my right now, like the goal is not to be in a harness forever. It's just to be in it while I teach the skills at home. And as you teach skills at home, then maybe you go to a fenced-in field and practice stopping. And then maybe you go to a non-fenced field and practice stopping. And so those are kind of the steps for that.
And chapter 3 of my new book covers the whole thing, is about safety. And we have tips for safety at home, in the community, and at school. So check that out. You can get all the free book resources at turnautismaround.com, including chapter 1 and chapter 2 for free. Even if you have an older child, there's a lot in the book that can really help. So I think that was all good. So what's our next question?
Next question, I think, is going to have a similar answer to like 1 and 2, but it's my child throws items through the day. Sometimes when they're mad, but sometimes it seems like they enjoy it. They're sitting there and they're just throwing things and laughing or smiling. What can I do?
Lucas liked to dump things. He liked to dump bins of stuff, and he liked to, and it would dump soda or water bottles. If he'd find something open, if he'd find pens, he'd scribble on things. So a lot of that was like your knick-knack, recommendation is don't leave open cups around. Don't leave markers around. And so we had to get a lot more organized to prevent, like if he liked to dump things, we had to have those things high up on shelves and those sorts of things. I remember when our consultant first started, when we first started ABA and not the verbal behavior approach, she said, she had she was an awesome consultant, but she said, why don't we try this, which I don't know that I've ever talked about on the podcast or even on our courses, but she said, why don't we say, okay, you can dump this one thing. I remember it was like a set of Barney flashcards.
Yeah.
And that was a reinforcement. And so he'd do whatever we wanted him to do. And then we'd hand him the cards and say, you can dump it. And he'd dump it. And then if he dumped those, or if he dumped anything during therapy, we would not, a lot of people are like, oh, you need to clean that up. But then it's attention and they're getting out of quote unquote work, although we don't use the word work. So it can turn into this really vicious cycle. So we just ignored other dumping. And then at the end of the session, we'd be like, okay, now we need to clean up. And we'd have him help us clean up. But so we got some reinforcement, which enabled him to dump some things. We also, you could use something like a bucket of rice, which we obviously don't want him to dump, but we could get cups that he could dump or pour into like bath toy kind of things. So in the bath, we could have him, safe places to dump. We could take advantage of his dumping. And then also remember, dumping is cause and effect. And so all of our early learner materials are cause and effect. The shoebox, you put the flashcard in the slot, it disappears. We do use infant type toys, which are, seem so young. Like, why would we use a hammer and a ball for a 5-year-old? Well, if they're developmentally a 1 or a 2-year-old, they're going to like that kind of thing. They're going to like to dump things. So let's look at activities that actually we can praise them for that love of dumping.
Yeah. Yeah. And I think the same would come into throwing items. And I mean, if they're throwing things when mad or when, told no or something doesn't go their way, again, this is the same as biting. We want to position things so there's not a lot around they can throw, or bringing them to their bed with you and giving them pillows they can throw or something they can throw when they're upset.
Beanbag toss,
Beanbag toss.
throwing baskets,
Yeah.
basketball in a net, a Nerf ball,
Yeah.
throwing that kind of thing. These are things we throw. And when they, now if they are like clearing off desks, throwing, food.
Yeah.
Okay. Again, we are not going to give you reactive strategies because you got a whole lot more going on than throwing food or clearing desks if you've got that behavior. So we would take it all the way back. Have you done your one-page assessment, your one-page plan, your language sample? Do you have early learner materials? Well, we don't need early learner materials. She's too, quote unquote, high functioning for that. Oh, no, you might. And doesn't matter what the chronologic age is. I mean, maybe you don't need to go all the way back to, the early learner materials, but if you have a child of any age that's swiping desks, you need a whole lot more reinforcement, a whole lot more assessment and teaching strategies that are revolving around 8 positives to every negative.
Yeah. Yeah.
And I urge you, if you are in the toddler preschool age, professional or parent, to join a free workshop and think about joining our online community. And if you've got any child or clients over the age of 6, you can definitely join our verbal behavior bundle, because this isn't just like cutesy, let's stop throwing. This is their whole life. The whole trajectory of where you're going to go if they're throwing food or clearing desks is pretty emergent, that you get an emergency, that you get better teaching going.
Yeah. Yeah. And I would agree with that. Even if you have a child who's throwing for fun, that's a type of STEM. It's a cause and effect thing. They just don't know what else to do. The more we teach skills at the table, the more we can engage them through the day. The more, when you are busy and it's okay to throw, only having soft toys out that are okay to throw. Like, these are all things we can do, but it is, you do have to be really careful if you have a child who's just throwing because they don't have anything else to do, giving a lot of attention because they're, and engaging them after they throw can be really, make it go up. So definitely finding ways to prevent it before it happens. It's a good one.
No matter what the function. And
no matter what the
you're going to get throwing, say you get throwing at school, it's probably going to be a mixture of escape from difficult tasks and attention. And that's a messy double multiple function going on, and need a whole lot more assessment and planning. And when I say a whole lot more assessment and planning, I'm talking a one-page assessment that will take you 10 minutes. I'm not talking about going for, obviously, if you have severe problem behaviors and you have funding and you have resources, an FBA would be a very good idea. But I remember my last years of doing independent FBAs, I would insist that if you're going to have me in for an FBA, guess what? You're going to have to pay me to do a BB map too. Because I'm not just going in to talk about problem behaviors. It's always skills-based.
Yeah.
That's the problem.
Yeah. And I think, again, I'm going to read number 5, but I think it's pretty similar to the rest of these in that my child is jumping on the furniture and climbing all over the house to unsafe places. How can I stop this? And I mean, I think that ties into a lot of the same things as throwing, and what we talked about with safety outside is keep them engaged, keep them doing stuff. Climbing is really fun for a lot of kids, and the reaction they get because now they're on top of a dresser is obviously big. And so a lot of what we said about throwing, but Mary, there's also safety concerns like making sure dressers are attached to the wall, making sure all furniture is secure, and really teaching skills, assessing, trying to remove things they could climb on. I remember Brentley goes through lots of weird behavior. Like he cycles through behaviors. I mean, we can say, let's get rid of behaviors, and new behaviors are going to come up. One of them was actually climbing the fence outside, which is obviously dangerous. We have locks on the gate, but one of them was climbing the fence. But I remember what I did was I put like a piece of plywood only for like 3 weeks. So there was no way he could climb that fence. And then he forgot about that behavior and moved on. So a lot of the time, the more we can prevent by using gates in the kitchen if they're climbing the fridge, by, making the furniture less fun to jump on. Maybe we put stuff on the furniture so that they just don't get access to that. Sometimes that's the fastest way to stop it.
Right. And we recently did a podcast episode and a whole case study with Michelle C., which is 164. And we're going to link that in the show notes, both her episode as well as the case study. But I know in the episode, she said, like when she was making dinner, chopping things up, she would have her kids, like if they were small enough, in an infant carrier, if they were in a high chair, if they were, sitting on a high stool, and like giving them something to do there, if they could be involved with it. But even if they were an infant, she would have them up on the carrier watching her, and she'd be like, apple, and she'd be talking to them as she was cutting. You don't have to think about like 24/7, or obviously they're going to be sleeping some of that time, but waking hours, we talk about engaging kids during most of their waking hours. That's like 100 hours a week. So, we recommend little 15-minute table times and going up from there, but also in the natural environment, keep your kids or your clients with you. If you're in a school, kids love to be involved with like erasing the chalkboard or helping or sorting or just playing quietly, but near you, so that you can give them attention, so that they're not in the other room, especially if they're climbing or doing dangerous things. You're going to want to, and you might think, well, I work from home. I'm busy. I have multiple kids. Think about, if you can afford it, hiring a babysitter or a mommy's helper. If you've got older siblings, you can teach them how to engage the child appropriately. Look for church volunteers. If you have parents or aunts and uncles or lonely older people who are just looking for something to do. I mean, use as many resources as you can, and, get creative. And I know lots of parents without really many financial resources, have to be creative to look for ways to help you engage your kids. But I think those all go right hand in hand, really just funnel everything, every problem through the 4-step Turn Autism approach: assess, plan, teach, and evaluate, and really spend 95% of your time preventing problem behaviors. If you're not familiar with the courses, you can buy the mini course, nomoretimeout.com, for all the details on that. You can attend a free workshop if you want to join our full course, where you get a community with Kelsey and other Facebook advisors and myself in there sometimes. And we're going to be generating podcasts like this. Hopefully, if you like this podcast, we'd love an Apple review. We haven't gotten a lot of reviews for podcasts lately. We'd love Amazon reviews, any kind of reviews. And you might think, oh, Mary, I don't have time for reviews. Reviews really do help, especially if they're 5-star, obviously, but leave an honest review. But if you like something, it really would help to leave reviews, because it helps the algorithm get our message out to so many other parents and professionals out there who really do need it. So check the show notes. They're going to be loaded with all kinds of great things. marybarbera.com/171. This was a lot of fun, Kelsey. I think it went well. And I think we can try to do another few of these and see how it goes. But we get a lot of questions. Kelsey probably answers, 20 questions a day.
At least, yeah.
And more herself, and then we have others. So we're answering a lot of questions within our closed community. If you're out there, just getting started or wallowing or stuck, consider joining us, because we're going to, be producing these podcasts. But if you want to learn something quicker, more efficiently, the best place to do that is through our full online course. So hope to see you there. Check out the show notes. Thanks so much for your time, Kelsey. It's been fun, and you just do an amazing job as our community manager. So I want to thank you for all of your hard work over the years.
Well, thanks for having me. It's always fun to get different lenses on these questions.
Yeah. Okay. Have a good one.